Welcome to the inspiring success stories of the Accelerate project in Homabay County, where lives are being transformed and communities empowered. Join us as we delve into the impactful journeys of individuals touched by this initiative. With support from the Embassy of Denmark in Nairobi, Danida, the Gender Violence Recovery Center, Population Services Kenya, and Population Services International have joined forces to implement Project Accelerate. Accelerate, driven by the promise of the International Conference on Population and Development, ICPD25, aims to achieve zero unmet need for contraception, zero preventable maternal deaths, and zero gender-based violence and harmful practices.
My name is Monzia Dennis. I'm a programs officer coordinating GVRC activities here in Homabay County. GVRC, working with the partners under the Project Accelerate, has really impacted on the capacity of healthcare workers here in Homabay County in terms of documentation, referrals and linkages to ensure that survivors of gender-based violence receive the care that they deserve, as well as access to justice for them. Through the project, again, we work with community health promoters. We know they are the level ones in the current system, to make sure that they implement the UHC, the universal health coverage that the government is focusing on. And we work with them to improve referral, identification and reporting of cases of gender-based violence from the community level, because we understand it's at the community level where some cases just go unreported, and if they are well reported, we are able to achieve success even upwards. Lastly, on healthcare workers, issues of documentation. Through the project, we've been able to support the county in printing and distributing of documentation tools in all the facilities that we are supporting in Homabay County, and that has really helped in ensuring that cases of gender-based violence are well documented. For me, as a program coordinator here in Homabay County, we've really had an amazing time implementing the project because of its design, because it's resonating with the people. It's people-centered. When we're dealing with survivor, it's survivor-centered. And we appreciate the donor, the Embassy of Denmark in Nairobi, for this great initiative, for the support that they're giving GVRC and our partners in implementing a Project Accelerate. And we request more support so that we may continue supporting the people of Homabay, because Homabay is ready for the project and they are receptive to our program.
I'm Jared Ouso. I work with the TSC as the Curriculum Support Officer in Nguku Division. Myself, I've learned a lot from GVRC on issues of gender-based violence as far as the learners are concerned. The cases are they were so much notorious in my area of work and in the whole of Homabay County. But when they came in, there are some informations we didn't know. We didn't know what to do. Sometimes we could get issues and we were separate. We didn't even know what to do. But since they came in, we have information. My teachers have been empowered. The learners are empowered. They are able to help themselves and to help the others. We have gotten the skills. We now know if we get a case, we know where to go, we know what to do, and we know how to do it. That information has given us power, and we are so much empowered.
My name is Jacob Dollar. Jacob Dollar works with the Teacher Service Commission as my employer, but specifically I work within Homabay County and Homabay Sub-County. We interacted with the GVRC because this is an organization which is looking at the gender violence that is facing the learners, and we realized that there are so many cases of gender violence. The learners who are being abused, and the learners sometimes are not aware of how to behave when they have been abused. I want to thank the donor, the Danida, because the Danida has brought in funds, and we appreciate the way this fund has been spent in educating teachers, in spreading, in fighting gender-based violence.
I'm a mental health nurse from GBV-SRHR County Hospital. In this sector of gender-based violence, I am supporting the psychosocial sector, where I give girls health talk, we do sessions, we motivate them, we give them hopes for the life tomorrow. We form different groups depending on their age. In these groups we have teenage mothers, in these groups we have adolescents, in these groups we have under 5s or even upper 5s but less than 18 years. All these programs have really improved this life so much. When you check at the parents, some were so hostile when their kids went through this violence. To some, they thought it was a mistake of the children, so they went ahead and became so violent against their own children. Maybe it was because of maybe financial issues, psychological issues at home, that when all this again happened, it really paralyzed their understanding, their mental status, and without this psychosocial therapy, they would have been somewhere else.
I'm called Margaret Manyango. I work in the county of Homabay as a psychiatric nurse, placed at Hope Center, that is a gender-based violence rescue center. The most cases that we normally see are the sexual gender-based violence cases, mostly with the children, the defilement cases. There have been of a high number. And as a Hope Center, we will present our survivors in court with our PRC forms and feel well, and the P3 forms, which we present to court for justice for our survivors. Through the support of GBV-SRHR, we have worked well with them. They have been supportive of this department of Hope Center. All the activities here have been supportive. We have been working well with them, and we have been supporting survivors hand in hand.
Jina naitwa Judith Atieno Ongenjo. I'm a CHP Gamba North Village. CHP anasaidia watu kwa village. Kwanza under 5 anasaidia sana. Kama naenda kuangalia, anatembea angalie watu wanaendelea kwa village aje. Kama unapata mtu wa pregnancy hajaanza, clinic naenda fasensi napeleka. Hata under 5 anapeleka. Mtu ana cough after 2 weeks hajaenda hospitali, ana transfer aende hospitali. Sisi ni grassroots CHPs. Ndio nasaidia sisi. Juu ya kama nimepata case, kama mimi nimeshapata case this month, ndio napiga simu kama deno. Nipigia deno hivyo mpaka hiyo msichana apate haki yake. Ndio naona kama JRV amepata nini, ameleta hiyo kitu ni mzuri. Nataka uendelee vizuri kwa maendeleo. Nimeshukuru sana Embassy Denmark na GBV-SRHR. Umefanya kazi vizuri kwa hii sub county ya Sobano, na kama kuna uongeza Homabay County ya Saul, ufanye corner, every corner. Hiyo kazi yenu na kazi yetu aendelea vizuri.
My name is Janet Bonareri. I work with the Ministry of Health in Beta Sub-County. I coordinate GBV activities and AYSRH activities. Those are activities alongside adolescent health and sexual reproductive health in Beta Sub-County. I want to appreciate the job that we've had done in partnership with GBV-SRHR in Mbita sub-county specifically, working with the young people in preventing GBV issues, working with the community health promoters to prevent and even sensitize the community on GBV issues, preventive and promoting access to services. We work hand in hand with the GVRC, both in the community and in the facilities, just to see that we are eliminating this issue that we have at hand, GBV, generally for both the young and the old. We know that GBV, someone cannot manage on its own, or just a department cannot manage on its own. We need the multi-sectoral approach. So we really need to intensify this both in the community and at the facility level to bring on board all the stakeholders to just help us eliminate GBV. As we've said, it's a menace that really needs to be eliminated.